Today marks a pretty big moment in the fight against COVID-19. Most coronavirus restrictions are being lifted across New York, New Jersey, and Connecticut, where almost every business is now allowed to operate at 100% capacity, just so long as they can still implement social distancing rules. In New York and Connecticut, all fully vaccinated people can safely drop the mask and stop social distancing, even indoors. In New Jersey, things are a little different. Mask mandates are still in place for all indoor activities. Joining us now to break it all down is Dr. Murtaza Akhter, emergency physician at the University of Arizona College of Medicine, Phoenix. Dr. Akhter, good to have you with us. So these restrictions, a lot of people are saying lifting them means we're back to normal. What would you have to say about that?
Well, thank you for having me. We're not quite back to normal, obviously. There are still cases, and there are obviously people who still get sick and come to the hospital. I still see them. But in terms of your ability to do things if you're vaccinated, it's almost similar to the pre-pandemic period. In fact, the CDC explicitly said that for those people who are vaccinated, they can, by and large, go back to doing pre-pandemic activities. But that being said, a lot of people aren't vaccinated. So that's a big if when they say if you're vaccinated. And so as you have seen out in the public, there are a lot of people who are still masking, both outdoors and indoors. And there are still people who are trying to distance because they're concerned about their own health. Obviously, you're your best agent for yourself. But if you really have been vaccinated, the risks of both contracting and of spreading, especially severe disease, that's what we're looking about. Not just disease, but severe disease is quite low. And that's why you've got that announcement recently from the EU that people may be able to travel to Europe again. They're looking at us. They want American tourists, and that's what they're looking forward to this summer.
What about variants? Because we haven't heard too much. We have heard some headlines about variants here in the United States, but I think a lot of the headlines around variants have been in other countries, in the UK, South Africa, Brazil, India, for example. If we do this loosening of cross-border travel, is there a possibility, even if it's vaccinated tourists that are making these travels and going to visit these other countries, that we might see an uptick in some of these variants being spread, especially as there's a lot of questions and concerns about the effectiveness of the vaccines against some of those variants?
Yeah, that's a great question. Now, keep in mind, a lot of these variants are in the States. And so if you were to genetically sequence every single patient with COVID, you'd see a lot more of the variants than you're calculating right now. And obviously, travel will increase that. But what really increases variants is not just going to other countries. It does. That's how pandemics spread. But also the longer a virus is around. And so whether you're talking about the UK or India or Brazil or whatever country you want to talk about, the United States will have its own variants too if you let the virus spread long enough and remain in the country long enough. And so not only do we have to be concerned about which variants might come into the country, we also have to be concerned about variants we might be spreading in other countries, in particular countries that aren't as well vaccinated as we are. And so we've got this perk, this benefit, being where we are, that we have the ability to be vaccinated pretty much. If you're an adult that you want to be vaccinated, you can pretty much get it without much issue here. Not every other country has that potential. Europe is obviously better than a lot of third world countries. So for people who are thinking of traveling everywhere, that is not something I would recommend. There are plenty of countries where people aren't vaccinated. And not only is the concern, like you mentioned, what variants can come here, but in particular, what variants can we export to other places, especially if unvaccinated people travel. And we know that'll happen. We know there'll be unvaccinated people who take this as a message that they can travel too. That is not the message that we are trying to say from the public health perspective.
So, Doctor, you mentioned a moment ago the European Union now opening its borders to fully vaccinated people to travel into their countries. We still have the issue of how do you prove that somebody has been vaccinated and how are they going to ask for that proof? But aren't we really putting ourselves at risk doing this now when less than half our own country is fully vaccinated? The fact that we can have people leaving here, traveling to Europe, perhaps contracting something there, coming back here and easily spreading it. And then before we know it, we've got a second wave raging here in the U.S.
So two excellent questions in there. For one, how do you actually enforce who's vaccinated? Because it's not like, much to the chagrin of some of these QAnon people, we don't actually have a biochip in us. Bill Gates isn't tracking us. So there's really no way of knowing whether you've been vaccinated, other than telling people you're vaccinated and hoping that it's true. And then we've talked about vaccine passports. Remember, what you get when you get a shot here is basically a signature and a date on a piece of paper that says CDC on it. And so it's not like it's a social security number. It's not like a passport, a literal passport where it can actually track you. And one of the questions the EU is struggling with is how will they be able to enforce and determine whether somebody's truly vaccinated or whether they're just saying they're vaccinated. And honestly, even if you show them a piece of paper, could that be something that's forged? I mean, that's one of the concerns that they'll obviously have about people coming over. As for the wave, there's always a concern that there may be a wave, and usually that concern lasts in particular with the unvaccinated groups. So again, if you're vaccinated and you live with people who are, whether they're elderly or young, but for some reason aren't vaccinated, remember, you can probably still spread the disease. We think the transmission risk is low for vaccinated people, but it's still possible. We know vaccinated people can still get the disease, even if not the severe version. It is still possible to also spread the disease. And so that's why all these guidelines say, even if you're gathering within the country, forget travel, even if you're gathering within the country, it's only vaccinated people that are allowed to gather. So it's not like you can have small gatherings and like, yeah, a couple of them aren't vaccinated, it's okay. We do not have herd immunity. We do not have herd immunity. And so we are only saying that people who are vaccinated can hang out. And that's the same for travel, because you are right. If people, even if they're vaccinated, travel and bring back the disease, even if they don't get sick, they can spread it to others. So again, we want to reiterate that the people we want traveling are the ones who can, the people we're allowing to travel, or we want saying that maybe it's okay to travel, is the ones who are vaccinated, and also won't spread it to unvaccinated people. Remember, in the healthcare setting, I see both vaccinated and unvaccinated people. So somebody like me has to be particularly careful where I go so that I don't spread it to my patients.
All right, we're going to have to leave it there. Dr. Murtaza Akhter, thanks so much for being with us and for sharing your insights today.